In the name of Allah, the most beneficent and the most merciful. Myself, Minahil Tanveer, Reet Fatma, Amna Shahid, and Husnain Raza belong to Group Explorers from University of Central Punjab. Today, we are going to discuss the drug neomycin. Neomycin belongs to aminoglycoside class of antibiotics. Aminoglycoside antibiotics are a potent group of broad-spectrum antibiotics that manifest their effect through the inhibition of bacterial protein synthesis. Aminoglycosides bind to 30S ribosomes and block the initiation of protein synthesis, cause addition of incorrect amino acid resulting in the synthesis of abnormal proteins, cause misreading of messenger RNA, and terminate protein synthesis. Neomycin comes in different dosage form. There are some common brands of neomycin: neofaridin oral solution, neomycin and polymyxin B sulfate ointment, autosporin air drops, neomycin and dexamethasone eye drops. Neomycin was discovered in 1949 by the microbiologist Selman Waksman. It is produced naturally by the bacterium Streptomyces fradiae. It is active against both gram-negative bacilli and some gram-positive cocci. Neomycin A is the degradation product of neomycin B and C. Commercially, it contains 90% of neomycin B, remainder being neomycin C. Neomycin is made up of amino groups attached to glycoside, derivatives of sugar, C23H46 N6O13. Its smaller mass is 614.644. It is administered through intravenous, intravascular, oral, and topical route. Poorly absorbed in gastrointestinal tract, so poorly distributed. Metabolism is deemed to be negligible. 97% of the drug is excreted unchanged in feces. Half-life is 2 to 3 hours. Moving towards the mechanism of action, basically in very simple terms, it is protein synthesis inhibitor. And in protein synthesis inhibitor for the inhibition of protein synthesis in bacteria. Of course, there are two different subunits of ribosomes, 50S and 30S subunits. Normally, what happens, you can see the 5' to 3' messenger RNA present and ribosome is sitting there. Duration of movement is 5' to 3' and normal or mature protein is formed as seen. If neomycin, that is aminoglycoside antibiotic, is present, that it can do three different effects A, B and C as shown. First of all, it blocks the initiation of protein synthesis. Second one, blocks further translation and elicit premature termination. And the third one, incorporation of incorrect amino acid. It allows the misreading of messenger RNA by the ribosomes to add incorporation of incorrect amino acid, which will ultimately lead to the formation of abnormal protein. So all these three features are done and they can ultimately prevent the protein synthesis process in bacteria, thus killing the bacteria, because if the required protein is not formed, the bacteria will not survive. Neomycin belongs to a class of drugs known as aminoglycoside antibiotics. It works by stopping the growth of bacteria in the intestine. This medication is used to decrease the risk of infection after certain intestinal surgeries. Neomycin is used in bowel preparation before surgery, also used in hepatic coma. Clinical uses of neomycin as a topical. Neomycin, an antibiotic, is used to prevent or treat skin infections caused by bacteria. It is not effective against fungal or viral infections. The toxicities associated with aminoglycosides are severe and are sometimes irreversible, and the margin of safety between a toxic and therapeutic dose is narrow. Clinical toxic features are ototoxicity, nephrotoxicity, and neuromuscular blockade. Ototoxicity. Drug is slowly removed when plasma concentration falls, but when there is high plasma concentration, the vestibular and conchoidal cells undergo concentration-dependent destructive changes, leading to progressive hearing loss, headache, vomiting, etc. Nephrotoxicity. Neomycin is in high concentration in renal cortex, and in this way nephrotoxicity is manifested with tubular damage, low glomerular filtration rate and nitrogen retention. Neuromuscular blockade. All aminoglycosides are capable of causing neuromuscular blockade with consequent paralysis. Reduce acetylcholine release from motor nerve endings. They interfere with mobilization of centrally located synaptic vesicles diffuse with terminal membrane, ultimately decrease sensitivity of muscle end plate to acetylcholine. Then the question arises, if toxicity of drug occurs, how to overcome the toxicity? Charcoal administration, maintain good urine output, peritoneal or hemodialysis. That's all from our side. Thank you.